I like to think of food in terms of sugar cubes. I'm a very visual learner, so I do this with my patients in my office. I eat healthy. That's great. I know you do. Tell me about a normal day of eating, and they'll tell me, and then I just start dumping out sugar cubes. Here's breakfast. Here's what you had for lunch. Here's what you had for a snack. Here's would you eat these many sugar cubes if I put them in front of you? And they look at it and they go, no. And I'm like, then don't do this. How do we help you not do this?
Well, good afternoon. Welcome to the Tailored Method for Pain-Free Living podcast. I'm here with my special guest, Joan Booker Keel, who has been in the healthcare field for over 27 years and is a nurse practitioner dealing with advanced precision hormone therapy. Joan, it is a pleasure to have you on our show. Welcome to the show.
Thank you, Dr. Ted. It's a pleasure to be here. Thank you.
So you and I happened to meet by providence. I think God's arrangement here. We met. We didn't intend to meet. We met at Stephanie Hunter's. She had her seminar recently in Chattanooga, Tennessee, and you and Stephanie were already working together. And then she introduced us, and then you and I got to talking about hormones. And what you were saying, I thought was so fascinating. I said, we got to get this gal on the show. And so here we are. So just tell us, what got you into doing advanced precision hormone therapy?
Oh, it was by accident, truly. I am not the greatest at science, nor am I great at math, but by divine intervention, I do truly believe that I was led to a path of being a nurse practitioner. And then in my journey, as soon as I got out of Vanderbilt, tried to go back to the emergency room as an NP, quickly learned that you can't be the boss of the people you used to be peers with, if you will. Plus, I had done my share of nights, weekends, and holidays. So I had done a couple other small things along the way, and then by accident fell into working for a clinic that did hormone replacement therapy. So the medical provider there happens to still be my collaborating physician today in Tennessee. But interestingly enough, about 4 to 5 years ago, I can remember calling him up and saying to Dr. Rowland, it's time for the teacher to go back to school because the student has become the teacher. I have surpassed his knowledge years ago on hormone replacement therapy. Into it beginning almost 14 years ago, I realized pretty quickly that even though I didn't have the education about it that I do now, as I continue to go to courses and learn and study, that we weren't doing it completely right in the beginning there with the clinic that he was the medical director for. So through the process of elimination, I eventually moved along and have always done hormones in one capacity or another, regardless of whatever capacity I've been working as an NP, as I have found, learned, discovered, know firsthand, and have seen time after time the changes in health and wellness by virtue of just optimizing metabolic function, replacing what's been lost, and through this process, realizing that a lot of the age-related diseases that we face can be prevented and or reversed. And so it's been my blessing, my pleasure, my joy that I have had many patients who we've reversed them from being a type 2 diabetic. We have by accident, and I say by accident, have got their weight down under control. I don't do weight loss. That's not what I do. It's not my focus. I believe that if we function on metabolic function and if we focus on that, then by virtue of optimizing all the things that allow our engine to run, if you will, then we can naturally get the weight off by virtue of putting back those hormones, which are responsible for helping to regulate insulin resistance, inflammation, and then consequently all the things that come with it, such as elevated cholesterol, thickening around the middle, loss of muscle mass, decrease in sleep. As we all know, sleep is paramount for health and wellness, not to mention weight. So if we can get those things back in prime condition over the course of 3 months, 6 months, a year, then we often will find that the thing that comes with that naturally is the weight loss. And the weight loss that comes with hormone replacement therapy is slow, it's steady, but it's permanent. And that's the key. So many people want a quick fix, but we didn't get unfixed overnight. So it takes us some time. So teaching people patience and commitment to participate, but giving them the tools to participate is key. And that's what hormones allow us to do, which is to see the results of the work that we do when we participate with the things that we're asked to do.
Right. I've heard some practitioners say that hormones are secondary to overall health.
I believe they are primary to overall health.
So let's hear your point of view in regards to hormones being primary to overall health.
So, well, we could go down many venues on this, but just in general, if we speak about the fact that on average, again, understanding that life is a bell-shaped curve, that on average, the majority of us don't run into a situation of elevated cholesterol till our mid-40s. We don't start running into sleep problems necessarily until our mid-30s or 40s. We don't start to necessarily gain weight until our mid-30s or 40s. And that is because as we begin to age, we begin into for women, the perimenopausal phase, and for men, the loss of androgen or testosterone. Most men start to lose testosterone starting around age 30 to 35, and they start to lose it on an average of anywhere from 2 to 10% per year. Our problem in healthcare is we don't do a baseline check at 30 as to what a man's baseline testosterone is. And so therefore a loss of 2 to 10% at 650 total testosterone is much more significant than a loss of 10% at 1250, right? So ultimately also the problem that happens in the men's arena is not only do we not get a baseline of what testosterone looks like, we also, a lot of providers will never look at free testosterone. And you have to look at the free because in the world of labs, free testosterone, as with free thyroid of T3 and free T4, what's available for the body to use. So we want to know what the free is. And most folks don't even think to look at that or don't know to pull a free testosterone. And then, of course, there's some elements around all that that we want to look at. For women, if you're in the arena of being what I call a one-off PCOS, and PCOS is polycystic ovarian syndrome, which is a horrible name because it really doesn't describe what's going on. You do not have to have ovarian cysts to be a polycystic ovarian female, but in that arena of PCOS, there's insulin resistance polycystic, there's androgen driven polycystic, there's combination, there's a thing called estrogen dominance, which is really kind of a myth, but you can have not enough progesterone, really is what it comes down to. That can drive PCOS. And all these variations, there's like 7 to 8 variations of PCOS can be happening to us as females in our teens and 20s. Some will see the ramifications early. Some will be like me and not manifest until later. I didn't get the acne until I was 27. I didn't get heavy till I hit my 30s. But the underlying theme for myself and many of us is the abnormal bleeding or the abnormal menses, and menses can be abnormal in that it cannot exist for 3 or 4 months at a time, or you can bleed regularly, have a regular cycle, but your menses are very heavy, clotty, sometimes debilitating for some people. So that doesn't really get looked at, and it often gets dismissed in young girls. So when we look at that component of females, if you can address the loss of progesterone or the lack of progesterone, that's really the underlying purveyor of that, you can often prevent early onset menopause. You can also prevent a lot of cancer growth and prevent and issues or other issues that come with it. And then if we can keep our hormones optimized through our 30s and 40s, then we prevent these age-related diseases such as elevated cholesterol, weight gain, missed sleep, because a lot of what we deal with again, there's a lot of weird and orphan diseases out there, don't misunderstand me, but our basic health and wellness that most of us deal with are the weight gain, the lack of sleep, the elevated cholesterol. And it's really very easily managed and fixed and prevented by optimizing the thing that we tend to lose as we get older, which is our metabolic function. That makes sense? I know it's a lot.
So what's the connection between hormone imbalance and elevated cholesterol?
So as you lose hormone function or metabolic function, you tend to get more inflammation. More inflammation leads to more insulin. Insulin leads to higher cholesterol levels. Also, as we tend to become metabolically imbalanced, we tend to, a lot of people will say, and you'll hear them say that I didn't really crave sugar younger, but now I crave more sugar. So as insulin goes up or spikes because we're losing metabolic function, we tend to crave more sugar because insulin demands what? Insulin has to match up to sugar. So when we're producing more insulin, our cells become resistant to allowing insulin to do what it's supposed to do. That active insulin needs sugar. So then we drive ourselves to go put food in our mouth, and the food that we tend to reach for is the quick and easy, down and dirty carbohydrates, and not all carbs are bad. Don't misunderstand me, but carbs are sugar, and sugar causes inflammation and causes insulin resistance, which then therefore contributes to elevation of cholesterol. Also, sugar is the number one food, or carbohydrates are the number one food contributor to elevated cholesterol, more than virtually any other food substance we can put in our mouth of our macronutrients.
So it's the sugar that's increasing the cholesterol with a lot of
the carbohydrates converting into the sugar. Yes, because yes, there's good carbs and bad carbs, but all carbs are sugar. And when we get to a certain point, it really doesn't matter whether they're putting in good carbs or bad carbs. We're spiking insulin, which is then they're creating the issue.
So
yeah.
A lot of our listeners here are dealing with high cholesterol. What's your protocol that you like to do to help get their cholesterol down?
So in men, the hormone that is most contributory to lowering cholesterol is to reverse the insulin resistance and to elevate the estradiol. And this will be controversial to some people who may be getting hormone replacement therapy elsewhere. There are a lot of places that will put you on testosterone as a man, but automatically also put you on an estrogen blocker, which is something I do not do because the literature does not support blocking estrogen unless there's just a real purveyance of issues with having excessive estradiol. Estradiol is the hormone that lowers cholesterol in men, and estradiol and progesterone are the two hormones that lower cholesterol in women. So by virtue of optimizing those hormones, and how do you optimize estradiol in men? You raise estradiol in men by raising testosterone, and naturally they get a conversion of a certain percentage of testosterone into that estradiol component. So we raise estradiol in men by raising testosterone back to an optimal level. And then in women, we raise it by raising estradiol and progesterone back to their optimal levels. And then that also helps us work on the insulin resistance. And then we also have to look at the third component, in which is thyroid, because thyroid and testosterone also are natural hormones that help to regulate insulin. And by regulating insulin and reversing insulin resistance, we reduce our sugar intake. By reducing our sugar intake, we reduce our inflammatory response. By reducing our inflammatory response, we also reduce our cholesterol level. So it's kind of a little trifecta of dealing with insulin, the sex hormones, and thyroid.
Some patients are saying, but Joan, you don't know me. I have these sugar cravings and I just have no control over them. I've got to have my desserts. I've got to have my sugars. What's
Yes, I
causing
get it.
that? What is it that's causing that when they just say, I just feel like I have no control. I just got to have that.
It's an excess of insulin. And when we produce extra insulin, insulin has to match up to sugar. So this is very simple and it's a little more complex than this, but the way I explain it to my patients is this. For every carbohydrate we put into our mouth or every sugar molecule we put in our mouth, we spike an insulin molecule. Insulin has to attach to sugar. Sugar attaches to insulin. Insulin and sugar go through the bloodstream. Insulin is looking to attach to a cell to deposit that sugar for energy because carbohydrates are our energy macronutrient, right? We all agree on that. When the cells become resistant, they shut down the reception site for insulin and they don't allow insulin to attach. So then the pancreas gets the message that the sugar is not going into the cell and insulin needs more help. So the pancreas dumps out more insulin. So if you think about like being in China or Japan where they have the pushers, where they're trying to push people on the train to get them in, to get the doors closed, to keep the trains moving. Well, much the same kind of happens in our body where the pancreas will dump out more insulin to help push that sugar into the cell, right? Well, when the sugar won't go into the cell, then that sugar that's attached to the one insulin molecule breaks off and gets converted and stored as fat or taken up by the liver to get dumped out later. But then now you have all this other active insulin that needs to attach to what? Insulin drives what? Insulin drives hunger or cravings. Insulin has to attach to sugar. So now we have all this insulin. And so now food is calling our name because now we're hungry. I don't know about anybody else, but I was that person who I hit the floor in the morning. You better feed me breakfast. As I'm eating breakfast, I'm planning my snack, my lunch, my dinner, my snack, and I'm never satisfied. I can eat and still be full and still be starving. And a lot of that is insulin resistance. So by having all that extra insulin, because we've loaded up with carbs, because that's what we're craving, we can create this vicious cycle of an excessive insulin, which demands an excess of carbohydrates, which demands an excess of insulin, and the insulin resistance just continues to get worse. So to kill the cravings, we can use various tools. Thyroid's one of them. Testosterone is one of them. If needed and warranted, depending upon the severity of the insulin resistance, how much and how severe, metformin ER is an excellent tool. And of course, the GLP-1s, which are now the latest craves for weight loss. But I will say that's the last place I go until we've got everything else optimized first, because I want the weight loss to be permanent and to be sustainable. And unless you can afford to continue the GLP-1s, a lot of the time that weight loss is not sustainable or continuing unless you have balanced all the other functions along with it. So I
So
like to start
somebody
with
says,
balance.
I don't want to get on any pharmaceuticals for this. I want to do it all naturally and through diet and exercise. What advice would you give them?
Well, I would say that's great, but peptides are natural, if you will. Hormones are natural, if you will. We use bioidentical hormones in most places that do hormones these days. You'll be hard pressed unless you're at a mainstream office with somebody who doesn't understand hormones to get Premarin if you're a woman. Testosterone is testosterone, has been testosterone. Men have had it blessed, if you will, since the Germans discovered testosterone way back in the day. But with the estradiol and progesterone, you can do the bioidenticals. With thyroid, you've got MP thyroid and Armour, which are desiccated thyroids. And while those companies cannot claim biosimilarity because you have to go through a whole process with the FDA to claim biosimilarity, molecularly, we know that the desiccated thyroids are biosimilar, meaning they molecularly match up closer to what our body naturally produces. So we can use those. I am not anti-Synthroid. I am not anti-Cytomel if we're going that direction. It really comes down to what does a person tolerate, how well do they respond, and how do they metabolize. So I'm not anti-pharmaceutical. I'm not anti-all natural, keeping in mind that all natural isn't necessarily all good either, right? Some of the stuff that's natural will kill you in a heartbeat. So it's about finding that balance of what works for you as a human in terms of how you metabolize and use what we give you. And in order to keep in mind that when we exercise and when we intermittently fast, which I'm big proponents of, as I think you probably are too, we know the benefits of what exercise and intermittent fasting are for us as humans. The irony to that is if you don't have balanced thyroid, if your your triiodithyronine or your T3 is not optimized or where it should be, exercise and intermittent fasting actually suppress your metabolism. So you'll get about yay far down the road, hit a wall, and you won't lose any more weight. And then you become frustrated because you can't get any further. And you can't get any further because you've, in essence, killed your metabolism. And why does that happen? Well, if we're decreasing our intake and we're increasing our output through intermittent fasting and exercise, we have slowed down our metabolism, which is triiodithyronine. Now, hear me when I say, and let me say this clearly and loudly, we do not use thyroid for weight loss because that's inappropriate use of a medication. However, if we address afternoon fatigue, if we address numbness and tingling of the face and hands, if we address cold fingers, cold toes. I know people who live in Florida who still have cold fingers, cold toes, especially when you get to the winter months in the Central Florida and North Florida areas. If we address any of the other myriad of thyroid symptoms by optimizing thyroid and you happen to increase your metabolism, lose some weight, well, I'm so sorry, it's a terrible side effect. But that's ultimately what thyroid helps us do, which is to keep our metabolism optimized while we do all the other things that are good for us that actually kill our metabolism in the process. So for me, treatment for my patients is to look at the trifecta of what is thyroid doing, what are we doing with insulin, and what's going on with the sex hormones. You have to look at the triangle to get the balance. And that's kind of my approach is we don't just, here's your hormones, see you later. I'll address your lipids. I address your B12. We look at zinc. We look at insulin resistance. There is not one lab that says, Dr. Taylor, you're insulin resistant. It's looking at a cadre of labs that give us an indication, are we insulin resistant? If so, how much? And then how severe? And then what do we do about it? And those labs include looking at your glucose, which is your sugar. If your glucose is above 85 on a 10 to 12 hour fasting lab, good chance that you're insulin resistant. If your hemoglobin A1C is at 5.6 or 5.7 and you have an elevated glucose, well, now we're 2 strikes positive for insulin resistance. If your lipids are not within the range, and we can talk about that, but in general, if we're not within range there, that's another indication of insulin resistance. If we have a C-reactive protein high sensitivity, which is a cardiac marker for heart inflammation, if that's not less than 1, that's an indication of insulin resistance. If our homocysteine, which is a vascular inflammatory marker for the inside lining of our blood vessels, if that's not optimized at less than 8, that's another indication of insulin resistance. If our sex hormone binding globulin, strangest lab earth, I wish I had that brain that had discovered this. It's one of those labs that if it's too high, it's tying up our sex hormones. If it's too low, it's very indicative of insulin resistance. So if we're not mid-range, that's an indication. If our insulin returns to baseline at about 3 hours after we eat. So on a 10 to 12 hour fasting lab, less than 8 is good, less than 5 is optimal. The range on the lab value goes up to 24, and your lab could come back at a 19, and you're looking at it going, well, I'm within normal limits, I look good, but the literature shows and supports that we want to be less than 5. So if your insulin's above 5 on a 10 to 12 hour fasting lab, that's another indication of insulin resistance. So you look at the cadre of all the different labs, and then you can determine how insulin resistant somebody is. Are all of them positive, but just a little bit? Are a few of them positive, but a little bit? Are all of them positive and it's a lot? And then that helps determine what methods we use to help reverse that insulin resistance or how aggressive that we get. I don't know if that makes sense, but it does when we sit down with the labs and kind of go through it.
Yeah, so let's say you had one of your clients, you just run a gamut of labs, you discover they're insulin resistant. What's the game plan? Can this be reversed? Can you change this outcome? And what do you do to make that happen?
Yeah, so I'll just talk about myself. So I was 200 and almost 40 pounds. I'm 5'4". The more I ate right and the more I exercised, the fatter I got. If I had one more provider say to me, well, it's all your fault, go home, eat less, exercise more, I was going to choke somebody, right? So I had to go back to school, get my master's, and then kind of fall into hormones by accident to realize that my thyroid wasn't optimized. So I optimized my thyroid. And then I reversed my insulin resistance by, I use metformin ER. I use a 2,000 milligram dose daily, 1,000 in the morning, 1,000 midday. Relative to eating, if I only eat 1 meal a day, I only do 1,000 milligrams. I have cut back on my carbohydrate intake, but the hardest thing to do is stop the sugar when all you're doing is craving. So you use these tools to help bring down that craving to where eventually you can reduce what you're taking to curb it to reduce your insulin resistance. But then I also optimize my testosterone. I optimize my estradiol. I optimize my progesterone. In women, progesterone is our feel-good hormone. It's our sleep hormone. It's our weight loss hormone. It's a cholesterol-lowering hormone. Estradiol also contributes to all those factors as well as lowering cholesterol. And then testosterone by virtue of increasing metabolism, along with thyroid, which helps to address my afternoon fatigue, which I no longer suffer from. And by virtue of reversing what was once called Raynaud's phenomena, I was told that with my cold fingers and cold toes, I had Raynaud's. Well, I reversed my thyroid, got my thyroid optimized. I no longer have cold toes and cold fingers. I seldom put on a coat in the winter, a scarf and a nice sweater, and I'm good to go because I can tolerate the temperature fluctuations now. I don't freeze in the middle of the summer like I used to. So by virtue of addressing those components of thyroid, also optimize my metabolism. Testosterone increases your energy and metabolism, also increases your motivation. Motivation is paramount for anything. So by using the hormones and then, of course, adding metformin and magnesium glycinate, or otherwise known as biglycinate, magnesium helps to reverse insulin resistance. Fiber helps to reverse insulin resistance. So by adding these tools into my cachet of armament, I was able to reduce my weight down to 150 pounds. I could probably stand another 20, but I'm good at my age at 150. I'm healthy. My labs are all back within normal limits. I come from a huge cardiac risk factor family, but my cholesterol, since optimizing my hormones, is well within the limits of where it should be. My total cholesterol runs about 160. My triglycerides are around 48. My HDL is around 45. I'd like to see it higher, but that's where it's at, 45. My LDL is less than 90. I sit around 65 or 75. So I'll contend, sidebar note, that we're taught in school that the 5 components of heart disease are contributory to 3 things we cannot control, which age, gender, and genetics, and the other 2 are lifestyle and smoking. Well, I'll contend to you it's not even genetics. I'll contend to you that most often heart disease is related more to insulin resistance, because when you can reverse the insulin resistance, guess what happens to your cholesterol and all those other components that actually contribute to. And then we've shown, and they're starting to prove, that cholesterol is really not the bad guy that we've been taught through school, that statins are overly prescribed, that statins only improve all-cause mortality by about 4 days, and that they actually, in the process of trying to lower your LDL and your total cholesterol, the 2 components of cholesterol that are more important to look at are HDL and triglyceride ratio. Triglycerides are predominantly influenced by what? By carbohydrates. So if we reverse our insulin resistance, we decrease our cravings, we therefore reduce our carbohydrate intake, we therefore reduce our triglycerides, we improve our HDL. And when we up our HDL and lower our triglycerides, our risk factors for cardiac decrease significantly, as well as the weight starts to come off, blood pressure starts to go down. So it's a multifactorial approach. And that's just kind of a 30,000-foot overview, but that's what I was able to do with myself. So I've been there, got the t-shirt, wore it well, understand the frustration. Very sympathetic.
Yes. So you've helped women and men with their cravings then by balancing all those out. Let's talk about diet here. I mean, that's a big component here. In a general sense, you had some interesting things to say last time we spoke about diet and food, what to eat, how to eat, all that. Can you just talk to our audience about the importance of diet?
Sure. Well, first of all, I hate the word diet because it's ugly and it has a negative connotation and it puts a bad taste in our mouth, no pun intended, right? So I talk about what are just our nutritional component. What are we eating and why are we eating? The average human, Dr. Fung, if you're familiar with Dr. Jason Fung, he's a endocrinologist who trained at UCLA. He works out of Canada now, but he's written a book called The Obesity Code. Hopefully everybody's heard of it. He states very clearly and succinctly that ultimately, if you can reverse your insulin resistance, you can reverse your progression to type 2 diabetes. But he talks about the fact that you really want to look at the component of intermittent fasting, and then what we do put in our mouth is important. So 60% fat, 30% protein, and only about 10% carbs. If we have weight to lose, the average American could go 365 days and never eat a carbohydrate and be just fine because we have plenty of stored energy that we can break down and reverse. So I'm a big proponent of teaching people how to eat 60 30-10. Now, various people will respond differently, and sometimes you have to modify that relative to someone's metabolism in terms of how they process foods. But ultimately, if we can cut back on the simple carbohydrates and really until we get our weight where we want it to go, the complex carbs as well, then we force the body to go to the stored energy sources, aka fat, and we allow the body to then utilize itself to feed itself, excuse me, then to allow us to have optimal health and wellness, because it will happen. If we put in carbohydrates, though, we have given the body a short, quick source of energy. The body has no reason to go to the fat stores to break those down. It's hard in the beginning because detoxing off sugar, detoxing off carbohydrates is paramount to detoxing off heroin and nicotine. The three most addictive substances to the brain and the human body is heroin and the derivatives thereof, all your opiates, nicotine, and sugar. Sugar. And sugar comes hidden in lots of forms. So we have to know how to read our labels and know what we're looking at when we're talking about sugar. For example, I was doing this with a patient the other night who stopped by on their way through. They travel a lot, so I don't get to see them very often. A lot of what we do is by phone and by texting, believe it or not. But I was showing him how to read labels. He didn't know how to. He's a 48-year-old male. He doesn't know how to read a label. He thinks he does. We were discussing Cheerios, for example. If you look at a box of Cheerios, Cheerios promotes themselves as heart healthy. They'll lower your cholesterol. Well, I find it ironic because the box is like 27 grams of carbohydrates per serving, which is about 3/4 of a cup, which is not a lot. But the box says carbohydrates 27, but added sugar is only 7. So if you don't understand that carbohydrates are sugar, then you will think that Cheerios is healthy because there's 2 grams of fiber and 2 from 7 is 5. So I'm only getting 5 grams of sugar, right? Well, wrong. You're still getting 22 grams of sugar because all carbohydrates are sugar. So that's how the food industry misleads us as Americans to believe us and lull us into this concept that we're eating healthy. Cheerios, you might as well eat the box. You'll get more out of the fiber in the box than you will the cereal. So we teach people how to look at labels, how to read, and we start with baby steps. If you're not drinking 8 ounces of water a day, start there. Once you get that under your belt, then what's the thing that you do the most? I have one client who sweet tarts are their weakness, and they eat them every night before they go to bed. So how do we eliminate that? Well, we don't right off the bat. We start by reducing by half. And then we work on that for a week or 2 or 3 or a month. And then we go to a quarter. And then we work on reducing as we go along. Because if you ask somebody to do something just abruptly cold turkey, unless their personality is able to do that, you've lost them. They're never going to come back. So I never get into nutrition or what we're eating until about 6 to 8 weeks after we get our hormones going. And the reason for that is because if you don't have the cogs in your wheels turning, if you don't have the grease to burn them around, doesn't matter what you're doing on this side of it because your engine's not working. So I'd like to get your engine revved up and running first. And then we talk about the fuel you put in your car, for an analogy, to determine how fast, how clear, how good we want to go to unclog all the goop that's in there. And detoxing off sugar is a 2 to 4 week process. It's hard. It takes time. So again, I don't even get into that till 6 or 8 weeks down the road.
Especially as you're heading into Thanksgiving and Christmas and New Year's, don't you think?
Yep. It's tough. So I will say to folks, between the week of Thanksgiving, all Katie barred the door, all bets are off. Do what you're going to do. But if you do any processing before, like if you have gotten started or if you start to be aware, you'll find that you really do eat less during the holidays. And you're more likely to be able to say no because now you have an understanding that when you walk by that beautiful yeast roll or that bowl of candy or that whatever, you can go, that's poison and they're trying to kill me. Because really, ultimately, that's what the food industry is trying to do, is kill us slowly but surely. And then, of course, then you kind of buckle down between the end of Thanksgiving and Christmas and then allow yourself to just let Christmas be what it is, enjoy what you enjoy. Because again, by virtue of realizing that there are 365 reasons to have a party, but not every day is a day to have one. If you can just wrap your head around that, then on the days that it is something special, then it gets back to what it was in our forefathers' day, something special. And then it's not so detrimental to have that piece of cake, that pumpkin pie, that stuffing, that cranberry sauce, whatever. So I don't tell people they can't. I just say, how do we get you down the road? How do you enjoy your bourbon? I had one gentleman send me an entire dissertation on why bourbon was the thing to drink to lose weight.
Everybody can justify their eating habits, can't they?
We can. And I don't punish and I'm not negative. I laugh and go, okay, great. So how do we have your bourbon in moderation? We cut it down from 2 or 3 a night to 2 or 3 a week. To where it's actually enjoyable and you get to appreciate it. Because if I tell you, Dr. Taylor, you could never have this again, That's not realistic. I'm going to have birthday cake on my birthday. There's a bakery here in Chattanooga that makes the best cake on God's earth. And by God, that's the best gift you can give me. And I'm going to have it. The difference now versus 10 years ago, getting my hormones straight, was 10 years ago, I'd eat the whole cake by myself in private. I'd hide and shame myself, eat it. Now I can have a piece of cake and give the rest away and not feel bad.
Yeah.
Does that make sense?
You have the you don't have those cravings anymore. You've overcome.
It doesn't call my name. It doesn't say, come here, little girl. We're going to have this right now. So yes, it's exactly correct, because it changes the brain function. And when you can change your brain function, you know,
but
it's
if
right.
you're not careful, you can easily slip back into the old pattern if you get off the wagon, right?
It's easy to do if you're not aware. You have to pay attention and be aware. And one piece of cake won't kill you, but when you have the second and third, that's where things go bad. And then you add the milk. Most people don't realize that milk has 12 grams of carbohydrates per 8-ounce glass. If you're going to drink milk, people drink whole milk, get the fat out of it at least. But even at that, there's 12 grams of carbohydrates, which is 4 sugar cubes. I like to think of food in terms of sugar cubes. I'm a very visual learner. So I do this with my patients in my office. I eat healthy. That's great. I know you do. Tell me about a normal day of eating. And they'll tell me. And then I just start dumping out sugar cubes. Here's breakfast. Here's what you had for lunch. Here's what you had for a snack. Would you eat this many sugar cubes if I put them in front of you? And they look at it and they go, no. And I'm like, then don't do this. How do we help you not do this? And we do that by optimizing hormones and then teaching. And then, of course, water. People underestimate the power of water and what it does to fill us up, to clean out our kidneys, to rinse our cells, to kill cravings. If you get in the habit of 8 ounces of water a day minimum, and I know there's a lot of literature out there that says it doesn't matter whether it's coffee or tea or whatever. I disagree. You can have coffee and tea and count that as water after your initial 64 ounces of regular water, because you need about half your body weight in ounces of fluid a day regardless, right? I want 8 ounces of water for your body, for my body. That kills cravings as well. And people say water tastes bad. It's habitual. You learn to get off the sweet, if you will, and you find out that water actually tastes very refreshing. It's very satisfying. I'm sorry.
What are your thoughts on exercise helping with decreasing the cravings?
They will if your thyroid is optimized. But it's been proven that you can't out exercise the fork. Now, men have it easier than women because we're designed to have babies. Whether we do or don't, it's another story. But women are designed to have babies. So by virtue of being the reproductive body, we carry more fat naturally. You have to in order to carry a baby, right? So men can get down that road a little easier than women, but nonetheless, you can't outrun the fork. You just can't, or the knife or whatever. You've got to watch what you put in your mouth in order for exercise to be beneficial. But in order for exercise to be beneficial, after the age of about 35, if you don't have enough testosterone, you can't build muscle. You can't maintain the muscle that you built. You can't off that visceral fat and that the white and the brown fat around the gut. Testosterone, when you see belly fat, if it's not just a beer belly, a lot of it is a lack of testosterone. So if you get testosterone optimized again, you can decrease that thickening around the middle because it decreases that brown fat and the visceral fat. So yeah, there are people who have been successful with exercising and nothing else and getting there. A lot of that comes down to good pure genetics, but most of us weren't born with that set of genetics. So we need all the other components with it to make the exercise effective. Does that make sense? 99% of weight, Dr. Taylor, is what we put in our mouth, period, end of story. Didn't say health. I said weight.
Yep, I hear you. What are your thoughts on men and women plagued and riddled with estrogen dominance nowadays? What's your thoughts on that?
So we could spend 8 hours on estrogen dominance. It's really kind of a myth. And we have to understand that under the heading of estrogen, there's estrogen, estrone, estrase, and estradiol. And so which estrogen is it that's dominant, and what labs are we looking at? And what we actually need for good health, good heart health, for weight loss, for cholesterol lowering is estradiol. And for men, again, a lot of hormone clinics will block estradiol in men because it makes them weepy and womeny, and it makes them not have as much testosterone. Well, I'll disagree with that. You know, the literature per education through Dr. Rouzier shows that most men, we want their estradiol somewhere between 85 and 120 on the lab, which is super therapeutic because most lab values for most men go up to about 45. But estradiol is cardioprotective. It decreases the risk of heart attacks and strokes. Estradiol is brain protective. It decreases the risk of vascular dementia and Alzheimer's in men and women both, right? Estradiol is lubricating hormone for internal sphincters and valves for men and women. Estradiol is urinary tract health for men and women. Most importantly for men, estradiol is apoptotic, which is a big fancy word for cancer killing or prostate cancer health. So we want to prevent prostate cancer and shrink that prostate or keep it the right size by optimizing testosterone and estradiol. If you block estradiol, you've in essence taken away one of the greatest tools for reversing cardiovascular disease and prostate cancer. Why do we want to do that? So estrogen dominance is kind of a myth. It's about what's missing. And if you're lacking the androgen, the testosterone, you up the testosterone. Most men, I will say, the only guys that I have seen that have more estradiol than testosterone, sadly, have been some of the 16, 17, 22, 26-year-olds that I've run into. There is a book called The Esterification of America that came out a couple of years ago. It talks about all the endocrine disruptors in our system, and it talks about what's in the blood of babies born in the last 10 or 15 years, or something like 210 substances that are not supposed to be there that are contributory to this esterification that we've seen in generations coming up behind us. So that's a whole other ball game and a whole other ball of wax and a whole other conversation. But as far as true estrogen dominance goes, it's really kind of a myth. And there's lots of literature to back and support that, which we could talk about another time. We do a whole podcast on just that. So no, I like estradiol. I don't want to block it. I want it. And how do you keep the other estrogens from getting overridden? You keep your estradiol levels optimized. Estradiol is a good component.
Okay. Very interesting. It's been a fascinating show. Joan, you have so much to say. You are a plethora of information and wealth. How can people get a hold of you if they want to hear more about what you have to say? And you do telehealth, correct? And
I do telehealth
over the phone and whatnot. What's the number that they can best reach you, or email or whatnot?
So email, it's a mouthful. It's concierge healthcare direct at protonmail.com. And I'll say it again, concierge healthcare direct at protonmail.com. And I don't know why I picked it, because I can barely spell concierge myself.
And your telephone number?
My phone number is area code 423-994-7869. And that is actually my cell number, which is my office number. I'm a one-man show. I don't advertise. I don't have a website because I don't want all comers, if you will. If you found me through something like this or through my other patients, then I know that you have an interest and a desire to do something that's not quite so mainstream, although it's becoming more so in the last 13 years. But you're willing to understand that we're going to push lab values, because lab values don't necessarily mean that you're healthy. The absence of illness is not the indication of health. So that is kind of my motto and how I live. And I believe that you tend to your wellness, or you will be forced to tend to your illness. And I don't want to be sick. I am better at 60 than I ever was at 30. I take nothing but the handful of supplements and hormones. I take no other medications for diseases because I don't have any. And that has a lot to do with being healthy by optimizing hormones. But if you want to contact me by phone at 423-994-7869, text me first. So that way I know that it's somebody I need to get back with, because if it's a call from a number I don't know, which is probably not great business, I don't answer calls I don't know. So text me, let me know who you are, what you're looking for, and then I'll get back with you and we go from there.
Well, thank you, Joan, for being on the show and sharing your information and wealth of knowledge. It's been very enlightening. And again, if you are in the camp here, if what Joan was talking about has resonated with you, please give her a call. She is an expert at what she does, and it's been very enlightening and a pleasure to have you on the show.
Thank you, Dr. Tatum. Appreciate what you do. Keep doing the good work. It's hard, but it's worth it. You're welcome.
This is Dr. Derek Taylor signing off for the Taylor Method for Pain-Free Living podcast.
You've been listening to the Taylor Method for Pain-Free Living podcast. We hope that you found great value in this episode. For more information about the Taylor Method and our offices, visit www.drderektaylor.com. Make sure to tune in next week, as Dr. Taylor will be providing more knowledge and resources about pain-free living.